Well, imagine living in a town where the one practitioner was a midwife, paediatrician, mental health expert, surgeon, and a family doctor. That is the current situation in one Queensland town. Dr. Sarah McLeay, filling all those roles as critical staff shortages spiral out of control.
She joins us now from Claremont along with emergency physician Dr. Stephen Parnis, who is in Melbourne for us. Good morning to you both. Dr. McLeay, I want to come to you first. Now, you are literally a town's lifeline. That's a significant amount of pressure on one person.
Yes, it is. So we also have the support of locums at our local hospital, but essentially the main continuity of care falls on me.
And what is that like from a day-to-day perspective? We're hearing lots of things out of Queensland right now. There's a shortage of midwives. That people are having to give birth at home, and that's just in the city, let alone the country. What is day-to-day life for you?
It's unbelievably hectic. Everywhere I go, I see patients and they're, trying to get that extra bit of information. We're having trouble getting access to you. I play so many roles and I rely on so many specialists out of town to provide me with that backup support so that I can actually provide more than what is normal GP care.
But just to put people in the picture too, I mean, you're just north of Emerald, so that's 3 hours. Emerald's 3 hours drive up west of Rockhampton. I'm sure the facilities out there are already stretched. So how easy is it for you to get accessibility to those specialists where you are?
So it's a 3.5 hour drive for us to get patients to our tertiary centre where we have specialists. It's an hour and 15 minutes if we need things like x-rays, CT. So you're putting people with potential fractures in private cars to diagnose things. It's an incredibly difficult environment to operate in.
And that's the thing, isn't it? You've got to navigate through all of that. And then on top of that, we're hearing obviously about this payroll tax on GPs in Queensland. So the workload's a lot, but then there's this financial burden that's also quite hefty.
Exactly. So this is a real concern to general practice. Essentially, what we're seeing is that, the state governments are there saying to the public sector and the federal government, hey, please fund Medicare more. We need our GPs to be doing more of the workload because our hospitals are all backed up. But then on the flip side, they're taxing us. Yeah. And this money it's worth hundreds of thousands of dollars to some of these clinics, and we just don't know if we'll have to pay it.
OK, do the Medicare changes flag today? Does that fix that or does it hinder it? What happens?
We're a little bit concerned about that, to be honest. We kind of see that we're probably heading more towards an NHS-style system as opposed to staying more in what the Medicare model was designed for. We just need Medicare to be funded better. It's that simple. It works. We don't need an America system. We don't need an NHS system. We need Medicare to be funded correctly.
Yeah, you're right. It's worked so well for so long. Now, let's bring in Dr. Parnis now. This is just one of the many problems facing the healthcare system nationally. We're seeing each state put out its own fires, it would seem.
Yes, indeed, Sarah. I'm in awe of my regional colleagues who have to do so much with so little resources. We've got enormous demand, whether you are in country Australia or indeed in the middle of the city, and we don't have the resources that we need to provide the care that Australians rightly expect, whether it's the number of healthcare workers or the operating theatres or the hospital beds to provide care, let alone having the resources in the community where they can treat things earlier and much more cheaply than we do in hospital.
And Dr. Parnis, there seems to be a real issue at the moment in Victoria. It's not just at the moment, obviously it's been over a number of years now. The elective waiting lists are at a record high in Victoria. There was a man in The Age yesterday in an article who'd been waiting 2 years for elective surgery. I mean, the figures are almost 135,000 compared to 77,000 in New South Wales. I mean, this is astronomical. Obviously the Victorian government's tried to address that and want to crank up to 40,000 surgeries this year, but it seems like wishful thinking. How on earth are they going to make this happen?
Look, I agree. I think most of my medical colleagues are waiting to see any impact of increased funding or resourcing to enable us to really try and make a dent in the waiting lists. The principal cause, I think, has been the blowout as a result of the pandemic. Of course, Victoria did it much harder than any other part of the country, and so many patients have had unacceptably long delays because we were trying to keep people alive and not get infected. But again, we're also facing the fact that the number of hospital beds per head of population has gone down over 20 years, and you can't fix that overnight. The solutions, even with the best of intention, will take months, if not years, to really even start to change.
Yeah, and I'm sick of blaming the pandemic for things. I mean, it's been a problem in Victoria for literally 20 years. It's just absurd.
And you're seeing the backlog now in Queensland hospitals, even giving birth. That has escalated to a point now where women are choosing or trying to have births at home.
It's ridiculous. It shouldn't come to that.
It's terrible. Thank you so much, doctors. And we really appreciate your perspective from the city and the country.
Welcome back. Amid a maternity bypass crisis in Gladstone Hospital in Queensland's north, women are dangerously giving birth at home without the presence of a midwife or doctor.
That's where it's come to. For more, let's bring in President of Rural Doctors Association of Queensland, Dr Matt Mazel. Good morning, Doctor. Thanks for your time this morning. I know how busy you are in Goondiwindi. For those who don't know, what does it mean for a hospital to be under maternity bypass, and what are the flow-on effects?
Well, birthing is a collaborative service that relies on midwives, doctors, other allied health professionals to provide that mantle of safety for women and their families. And when there aren't enough of those staff, inadequate numbers in any of those groups, then the service really can't provide the safety that it should. In this case, it's numbers of doctors who have obstetric skills that are just not adequate to provide a safe service.
I mean, the risks would be obvious, but Doctor, talk us through just how dangerous it is for a pregnant woman to give birth at home.
See women endure incredible things in the role of birthing and childbirth, and it never ceases to amaze and inspire me. But we shouldn't be putting women in this sort of position where they have to make these sorts of decisions that they're making out of desperation. And the risks, can be the very worst. Birthing is a natural process, obviously, but there are inherent risks, and those risks require quite often the services of midwives and doctors, and those complications are not always predictable, can happen sometimes very quickly, and birthing at home does not have that same mantle of safety that our hospitals can and should provide.
Of course, some women and their families are very passionate about all of that and wanting to do it in that space. But I do think what you were saying then about the potential risks, hopefully they are aware of. What we don't want to see are families doing it because there's no other choice. And that's what it looks like we're seeing in some parts of regional Australia right now.
Yeah, women and families value and deserve safe birthing options close to home and on country. And we ought to be able to provide that. And indeed we do in many places. And that's done with a collaboration that includes certainly rurally and regionally quite often the involvement of rural generalists. So they're general practitioners with advanced skills in obstetrics and anaesthetics. And these professionals provide services to women having babies in fact, the large proportion of rural Australia. And I certainly feel like they may well have a role in the solutions going forward for Gladstone.
All right. We appreciate your time today. Ongoing issue, isn't it?
Yeah.
A terribly stressful time. How's everyone in Goondiwindi before we roll on? Have you been to the Victoria Hotel over the weekend, or the Queenslander more your style?
Well, I didn't get away. I know at least one of my children had a bit of fun at the QL, the Queenslander. But it's always a good time. But I've been a little bit too busy.
Too busy.
It's a busy time for all.
All right. I appreciate your time again, your expertise. Say good day to your kids for us.
Hey there, Today fans. Sarah and...
What's my name again?
Oh, my God. Carl.
Hey, thanks for watching our YouTube channel, though. Subscribe now for more news, special reports and amazing Aussie stories.
And Carl misbehaving,
Whoa,
of course.
That never happens.
Always happens.
What's she talking about?